Let's talk about ginger, and I need to be honest with you about what we actually know versus what's being claimed. Yes, ginger contains bioactive compounds, gingerol, shogol, and peridol, with anti-inflammatory and antioxidant properties. The research shows ginger extract inhibits influenza virus replication in laboratory settings. But we need to pump the brakes on some of the more enthusiastic claims circulating. First, there's a significant difference between what happens in a petri dish and what happens in your body. When you consume 1 to 2 inches of fresh ginger daily, you're not achieving the same concentrations used in these studies. The bioavailability, how much actually gets absorbed and reaches target tissues, is a question that doesn't have great answers yet. We're seeing a lot of extrapolation from in vitro studies to real-world recommendations without the clinical trials to bridge that gap. Now, ginger tea, those immune shots people are blending with ginger, lemon juice, turmeric, and cayenne, taking 1 to 2 ounces daily. These might be beneficial, but let's be clear about the evidence level. We have some data on ginger for nausea. That's fairly well established. The respiratory virus claims? Much more preliminary. The studies showing ginger extract inhibiting viral replication haven't translated into large-scale human trials demonstrating that eating fresh ginger prevents or treats colds and flu with any reliability. Here's what concerns me. People are being told to consume significant amounts of ginger daily based on limited evidence, and we're not talking enough about potential downsides. Ginger can interact with blood-thinning medications. If you're on anticoagulants, consuming large amounts of ginger could enhance their effects dangerously. We're also seeing people with sensitive stomachs experiencing irritation from concentrated ginger preparations, especially those immune shots that are basically pure ginger juice with some citrus. The recommendation to steep fresh grated ginger in hot water for 10 minutes, add lemon and honey, that's generally safe and might provide some comfort during illness. The soothing effect on sore throats is real, though that's partly just the warm liquid and honey doing their work. But let's not confuse comfort with cure. Sucking on fresh ginger slices for sore throats might help, or it might just irritate your already inflamed tissues. There's also the issue of quality and sourcing. Fresh ginger is superior to dried, fine, but what about pesticide residues? Commercial ginger isn't always organically grown, and the skin, which concentrates nutrients, also concentrates contaminants. Storing ginger in the freezer and grating frozen for convenience is practical advice, but we're not addressing the fundamental question. Is this making a clinically significant difference in your immune function? The claim that ginger stimulates circulation, helping deliver immune cells throughout the body, sounds good but lacks robust evidence. Your circulatory system doesn't need ginger to function. What we have is a warming sensation, which is pleasant, but that's different from measurably improved immune cell distribution. I'm not saying don't use ginger. I'm saying be realistic about what you're getting and don't substitute ginger for proven interventions like vaccines, adequate sleep, and hand hygiene.